Welcome. Did you know that up to 90% of your serotonin, one of your feel-good neurotransmitters, is produced in the digestive tract? Welcome. Today we are talking about the digestive tract, or the gut, and how it relates to mood and immune system. I am Dr. Wendy Lee White. This is Tune Into Your Body, the weekly webinar where I explore all sorts of things that are requested by you and give you an opportunity to maybe see things in a way that you've not thought of them before, or learn something new about your own body that you can apply to choices that you make on an everyday basis. I'm Dr. Wendy Lee White. I'm a licensed naturopathic doctor, nutritionist, and educator. And let's go back to the idea of serotonin made in the gut. So I opened today asking you if you knew that up to 90% of your serotonin is made in your digestive tract. Now, serotonin is a neurotransmitter. We often think of neurotransmitter and mood as like all up here. And we really, draw this imaginary line that disconnects the head and the brain and our moods and our emotions from the rest of our body. And I'd like to dispel that separation, that we are incredibly linked. Mind, body, spirit, mental, emotional, spiritual, and physical, it's all one big tangled spider web. More tangled than a spider web. More intricate, more complex. So when we think about serotonin, now the reason I use serotonin particularly as an example is most of us are familiar with the idea of serotonin because that is the neurotransmitter upon which many antidepressant pharmaceutical drugs, prescription drugs, have an action on. Lots of them not simply increase the serotonin, but lots of them make the serotonin that your body makes hang around longer and be active longer. And so when we separate out the idea that mood is separate from the rest of our body, we think of the approach to things like depression or mood disorders to be a brain neurotransmitter thing only. And really, that's just not the case. And I'll give you a couple of examples first, and then we'll talk about some biology. So two patients of mine in the history, and I'll give you a little example. One of them came into me, now this was about a month after she had had some abdominal pain, went to the emergency room. Unfortunately, I was on vacation that week, so I wasn't able to attend to her emails. So she went to the emergency room. Turned out they diagnosed her with a blockage in her intestine. They gave her liquid diet, et cetera, et cetera. No surgery was needed, but what she really was coming into me for a month later was that her mood had been terrible. She had been low and hopeless, and it was like a switch had been flipped the day that she had those GI issues. So we talked about the fact that 80 to 90% of serotonin is made in the digestive tract, and it makes absolute sense when the digestive tract is out of balance, when the cells that line the digestive tract are not functioning properly, if they're interfered with, inflamed, if your microbiome or your bacteria get out of balance. And so we had this discussion in office, and she sent me, and we did some digestive tract healing and soothing as the primary focus of her treatment. Now, she was coming in for mood concerns. She told me what had evolved in 4 weeks prior. And when we had that discussion about the relationship between digestive health and neurotransmitters and mood, she went home, conveyed it to her husband, and sent me this lovely message. I should have pulled it up and read it to you verbatim, but the gist of the message was, "Oh my goodness, thank you for explaining why I have felt not myself, not only for her, but also for her husband." Her husband was really concerned that his wife was heading into crisis. And the two of them were incredibly reassured that it made sense that her mood concerns stemmed from this GI event. And when they had sent her home from the hospital after her GI event and diagnosed her with the blockage, they had given her antibiotics, which would kill off any infection, but would not repopulate with good bacteria. And I believe they had put her on an anti-inflammatory of some sort. So antibiotics kill, and anti-inflammatory suppress inflammation. There was no discussion about healing or rebalancing or supporting that rebalancing of her body. That's what we did. Her mood improved. Within days, she felt a difference. And then within a couple of weeks, she felt like she was back to herself again. So that's one example. Another example I'd like to give you is a patient who had acute appendicitis, went to the hospital, got her appendix removed. And again, she followed up with me of, hey, my GI seems fine at this point, kind of back to the normal GI that she had experienced before the crisis. But she herself was struggling with lots of mood issues, lots of lack of motivation and snippiness, and she wasn't herself with her grandkids that she wanted to be. And so again, we talked about not only repopulating the gut. When you have major surgery, you're on antibiotics. When they take out the appendix actually serves a function of re-inoculating good bacteria into your system when your large intestine has been disrupted. If you have a colonoscopy, for example, where A, you flush everything out, and B, they're heading in the wrong way, without repopulating, your digestive tract suffers, and that's the function of the appendix. We often, in my lifetime anyway, and even through medical school, thought that the appendix was a vestigial organ, so something that served a purpose way back when, like our tailbone, when we used to have tails. And they thought the appendix was like that as well. And it turns out that it serves a really great function when we get wiped out, when we get a GI bug, when we get out of balance in our lower abdomen, in our lower GI tract. The appendix serves, and the reason I keep going like this is, think of a bulb syringe where you squeeze the bulb, or like a turkey baster, you squeeze the bulb and it squirts out. That's the function of the appendix. So she had had her appendix removed, and they didn't have any discussion about the good bacteria or bad bacteria that lived in her colon. So she felt very out of balance when she had this surgery and then didn't get the support afterwards that she would get from someone like me, a naturopathic doctor. So again, we did some gut healing. Now, in the first case, we did a lot of systemic gut healing, where we did some herbs that help to coat and soothe the digestive tract. We did some glutamine that helps cells turn over as quickly as possible because it's their favorite food. And we did some probiotics, as well as fermented food to get probiotics from a food source. With the patient who had had her appendix out, we primarily focused on re-inoculating. She felt as though she had no indigestion, no bloating. She felt like her upper GI tract was working quite well, but it was just her mood and her bowels that seemed a little bit off, and so we did that. One more thing about the idea of our microbiome, or about the bacteria that live in our digestive tract. There are great studies that connect variations in the bacteria that live in your digestive tract, that connect that with eating disorders, with symptoms on the autistic spectrum, with Parkinson's disease, with anxiety. So again, this is just research that supports the idea that mind, body, spirit are not separate, that our GI tract and the bacteria that live there can influence strongly how we manifest symptoms, how we get out of balance, to what extent and in what ways. So let me just welcome all of you who have joined since our intro. I am Dr. Wendy Lee White. I'm a licensed naturopathic doctor, nutritionist, and educator. and this is Tune Into Your Body. We are on episode 17 of my weekly webinar series. This began at the beginning of, well, not quite at the very beginning, but early on in our COVID stay-at-home orders. And I've continued through this time so that I can offer support. My goal for this is for you to know that you can make choices every single day throughout the day in what I'm calling the 5 essentials: nourishment, move, connect, choose, and balance. And so if you address all of these 5 essentials, you have access to tapping into the vitality that your body has when it's not irritated, overwhelmed, or suppressed. So today we are talking about the digestive tract and how all parts of your body are connected to the digestive tract. Hello, my love. My dog just came out to say hi. Apparently she was missing me inside. And so we're talking about how the digestive tract has a relationship with mood and with the immune system. And so let's talk about optimal digestive function. So imagine that I'm guiding you through the tube that is your digestive tract. So it starts in the hole of your mouth, ends in the hole of your anus, and it's a tube throughout. So let's talk about optimal digestion first, and then we'll kind of talk about some variations. Optimal digestion would be the moment you see or smell food, you begin to salivate. And that saliva gets ready to begin digestion in your mouth. So you take the food into your mouth and you chew quite well. The first step of optimal digestion is chewing and not swallowing until it's a paste-like or so. Now, a question I often get is, well, how many times do I need to chew to make it paste-like? And the answer is, I have no idea. It depends what you're eating. Now you could imagine that if you're having lentils and rice, you'll have to chew less than if you're having steak. But the general guide, and I'm fond of general guides, not rules. So the general guide is you swallow when it's all paste-like. The reason is you have teeth in your mouth, you don't have teeth in your stomach. Your stomach will digest best if what you swallow is paste-like, if there are no large chunks. The acid and enzymes in your stomach only can work on the surface area, only can work on the outside. So you can imagine if something came into your stomach in a large chunk, it's going to take quite a long time for the outside acid and enzymes to digest enough that it fully digests the chunk. Another visual is if you swallow when everything is paste-like, there's more surface area for the acid and enzymes to actively digest what you've given it. And so it will be a process filled with ease. So step 1, chew super well, swallow, and swallow when it's about paste-like. So now things are in your stomach. The acid and the enzymes that are given in your stomach are able to digest the food into very teeny tiny particles so that when the food passes from the stomach to the small intestine, everything is so tiny that all the structures in the small intestine can absorb it. Now, what doesn't get absorbed would be your fibers. The fibers need to continue down through the lower GI tract so that you're feeding the good bacteria and you're sloughing off the superficial cells that need sloughing. It's like sweeping away the clutter. Now, I'll continue on the optimal. So then the optimal would be that through these amazing structures in the small intestine, almost everything gets absorbed. So what are these amazing structures that I keep talking about? It blows my mind. There are miles and miles of surface area of your digestive tract in your small intestine alone. So what that looks like is pretend that this is the surface. It looks flat, right? But if we were to zoom in and look at the microscopy of it, very, very tiny structure of that flat surface, we'd see it's not flat at all. In fact, it has projections. It has villi. And villi look like this, so that you can see the surface area here is minimal. But if you can imagine that all across this flat surface area, there are finger-like projections, instead of having that amount of surface area, you've just probably doubled it at least, right? So that's the villi. Then imagine that on every surface of this villi, you have projections that are microvilli. So on every surface that looks like this, you then have very, very teeny projections, finger-likes, from each surface here. So if you were to straighten and flatten it all out, that's where you get the miles and miles of surface area. The reason we are designed that way, and I'm hoping you feel the awe of this design, the reason we're designed this way is so that we can maximize the possible surface area for absorbing all the nourishment from what we take in by mouth or what we eat. So everything's absorbed in the small intestine that can be absorbed, heads into the large intestine. The large intestine is where the majority of our good bacteria live. They make vitamin K, they make other things for us. We feed them with certain fatty acids, and it's really a symbiotic relationship. We give to them, they give to us. In the large intestine, that's where also fluid balance happens. So you will reabsorb some water to get the appropriate firmness of your stool. Let's talk about stool. How often can you have a conversation with a naturopathic doctor where it doesn't at some point in the conversation end up about poop? My daughter growing up, my husband has learned over the 20-something years that inevitably poop comes up in the conversation, whether it's regarding the dog or the child or yourself. So how often should you have a bowel movement? Here's that should word, right? There is normal variation within each of us. However, if someone is not having a bowel movement at least once per day, I consider that constipation. So I have to be very careful when I ask my patients about, tell me about your bowel habits. Early on as a newbie, I'd say, do you struggle with constipation or diarrhea? And people would say no. Then when I'd say, okay, tell me about your bowel movements. How often a day are you having a bowel movement? Oh, no, not every day, just once a week. That is constipation. Once every 3 days, that's constipation. Once every 2 days, guess what? That's constipation. If you're having a bowel movement daily that does not require straining or pushing, that does not have a foul, fermented, putrid odor, then that's a healthy bowel movement. So let me say that again without all of the knots. A healthy bowel movement is at least once a day where you get the urge, but it's not urgent. You find yourself in the bathroom, you have a seat, you have a bowel movement without much straining, without much effort. It happens, it comes out in a long movement that is roughly sausage thick, not hot dog thick, not pencil thin, not like meatballs, but sausage thick and a long movement without a foul odor. It's just mild odor. That is a healthy bowel movement at least once a day. If you vary from that, then you probably need additional support. So that is how the optimal digestive tract works. And notice I'm saying tract, T-R-A-C-T. That is the proper phrase, gastrointestinal tract. It is not track, T-R-A-C-K. It's not that. It's a pet peeve of mine. So now that we've talked about natural, optimal digestive function, let me take a station identification break and we'll go into kind of the things that can vary and how your mood and your immune system can be connected. This is episode 17 of Tune Into Your Body, my weekly webinar that explores the 5 essentials for you to be healthier every day. And today we are talking about gut health or gastrointestinal tract health and how mood and immune system are all related and connected to the digestive tract. This is a great explanation of why when someone comes to me with varying concerns, headaches, mood issues of anxiety or depression, lack of immune function, autoimmune issues, chronic pain, chronic inflammation, that explains why I am not looking at all of those symptoms individually, but I'm looking at the foundational shared underlying factor that contributes to all of those symptoms. So we've just talked about neurotransmitters and how up to 90% of serotonin, one of your feel-good neurotransmitters, is made in the digestive tract, and why with irritation and inflammation of the digestive tract, you can have manifestations in depression and anxiety. And we've also just kind of run through optimal digestion from the mouth to the anus, what optimal digestion looks like. Now let's talk about when things go out of optimal digestion. Now this can happen for many reasons. My dog is eating dirt and digging her nose deeply, deeply into the ground to get more dirt. I'm not going to call to stop her because that would hurt your ears. So let's talk about why digestive function can deviate from normal or optimal or our well design. It can be due to stress. Chronic stress alone is enough to cause inflammation of the digestive tract. Antibiotic use can disrupt the bacterial balance that exists in our digestive tract. Did you know that pesticide, the common pesticide Roundup, I know the scientific name and it just escapes me right now. That's absurd. Anyway, the common pesticide Roundup, which is in most conventionally grown fruits and veggies, that in and of itself kills good bacteria in our digestive tract. So if you're eating conventionally grown produce, you are inhibiting your digestive tract. Stress can lower acid production in the stomach. As we age, our acid production can decrease and the acidity of our acid can decrease. All of these things can have an influence on our digestive tract function. If we consistently and often eat foods that irritate us, we'll talk about that in a little bit, then we can feel as though we are doing damage to our tissue, and that can very well be the case. So let's talk about foods that irritate us or that don't work super well for us and how that relates to our digestive tract. I'll have patients say to me that red sauce or pasta sauce or tomato sauce gives them heartburn. My follow-up question often is, well then, how often do you choose to eat that? And sometimes, quite often, it's, at least once a week, several times a week, almost daily, depending on what the irritant is. And my question is, well, why? If you know it irritates you, why do you continue doing it with such frequency? Now, I'm not saying why do you continue to do it ever, because there is pleasure, there is emotional connection. We are human beings on all levels. But my question is, why do you continue to do it as frequently as you do it? And usually it's because people don't really understand that damage can be done. They think that if they get the heartburn, they take the Tums, okay, no big deal, no harm, no foul. But that's not the case. When we damage our tissue or irritate our tissue and don't support its recovery, each time we do that, before it has recovered from the previous, we're doing more and more and more damage. And most people don't have regular practices that encourage nourishment and healing. And so the damage just keeps being cumulative. So things get out of balance in all these ways. And what that might look like, starting from top to bottom, is difficulty swallowing, heartburn, burping, gas. So that's kind of the upper GI, stomach related. Then there's gas and bloating, and the gas can be either discomfort or, feeling pain as bubbles are moving through. That's often small intestine or upper GI, which is kind of above the belly button, but in the soft spot of your abdomen. Then we can have passing gas or continued gas and bloating and indigestion sensation below the belly button. That's often large intestine, although there is overlap, so those are just guidelines. What also can happen as far as discomfort goes, if we have chronic irritation, we are then more likely to be more irritated by everything else that we eat. So think of a cut on your hand. If you had a cut on your hand and did nothing about it, every time you washed your hands, every time you put your hands in dishwater, every time you got anything, you rubbed your hand, you pulled your pants up and tucked in your shirt and rubbed it, every time you'd be doing that, you'd be irritating the heck out of the poor wound on your hand. Think about your digestive tract. The lining of your digestive tract is very similar to your skin. They're both mucosal tissues. So think about an irritation in the digestive tract that doesn't get a break to rest and heal, and yet keeps getting irritated. That hurts just thinking about it. So if we give the digestive tract time to rest and heal, maybe giving some, like I mentioned earlier, some demulcent herbs or some, basically it's like giving the digestive tract a slime layer or applying salve to a cut. Something that is soothing can help break that cycle, give your body time to heal so that then it's less irritated by further things. So we've talked quite a bit about why the digestive tract health has an effect on your mood. If you can picture those cells in your small intestine, the ones that had the villi and then the little microvilli, increasing surface area for absorption, when they get irritated and inflamed, they lose all of those cool surface area finger-like projections and they do flatten. You decrease your absorption of what you're eating, causing malnutrition, potentially metabolic imbalance because your body feels malnourished and your metabolism would respond accordingly. Now let's connect the digestive tract to the immune system. Again, imagine the small intestine with these finger-like projections. When the tissue is healthy, all cells are connected through a nice healthy lipid layer. So there's not a space between the cells. So when something enters the tube, that is your digestive tract, it cannot get into your blood supply or into the rest of your body without going through special doorways in between those cells or to enter a cell. It can't just go anywhere it wants. Things are regulated. So in a healthy digestive tract, you have great cell barriers, and so things that are in the tube of your digestive tract only can get out if they know the passcode. If your tissue is irritated, those cells can lose their integrity. So things that are passing through the tube of your digestive tract don't always have that protection. They can just get into your system, into your blood supply, into spaces between cells that they shouldn't be. That's when your immune system can get kicked up and say, hold on, you're not supposed to be here. Let's mount a response. Let's get you out of here. And people can get more chronic inflammatory processes. But remember, If someone were to just approach the immune system and say, oh, we need to shut down your immune system, you're developing responses you shouldn't, that's not the cause. The cause is that the digestive function was compromised, that the tissues got irritated, inflamed, and lost their good boundaries, and that is the cause of the immune dysfunction. It's not an immune system issue. The immune system's doing what it's supposed to do. It's the digestive tract that got derailed that caused the immune dysfunction. Part of naturopathic medicine is identifying and treating the underlying cause. Quite often, in mood disorders, in immune function, in chronic inflammation and pain, quite often that cause, that underlying cause, is dysfunction in the digestive tract. I hope you enjoyed today's webinar. This is Tune Into Your Body, the webinar that explores the 5 essentials for you to be healthier every day. Move, nourish, choose, connect, and balance. I'm Dr. Wendy Lee White. Thank you for joining me today. Next week, we will be discussing working from home, your relationship with food. And the last Thursday of August, we will be discussing movement for all bodies. And in that webinar, I will have my good friend Gina Daly, who is a certified personal trainer here in Portland, Oregon, and she and I will be chatting about movement for all bodies. I do hope that you can tune in. If you have enjoyed this, if you've learned something about yourself, learned something that you can take away and put into practice in this next week, please do share this webinar with friends. The more, the merrier. Thanks for tuning in and hope to see you next week. Take care.